Greetings and welcome to the Women in Fire radio show. Today we're going to talk about mental health. Last month we had a show on mental health, but we just want to expand on the topic some. Excuse me. Today we want to expand on the topic of mental health, talk about what resources are available to help individuals deal with mental health issues with the goal of everybody recognizing how important mental health is. There's long-term health effects that when people don't deal with mental health, is an essential aspect of our overall well-being, yet it often doesn't receive the attention that it deserves. Ignoring mental health can lead to a long range of long-term effects that impact various aspects of life, including education, work, and physical health. I'm Lisa Baker. I am the retired battalion chief, and I'm currently the Southwest Region trustee for Women in Fire. Today I have Taylor Montey, who is a lieutenant in the Poudre Fire Authority, which is in Fort Collins, Colorado, and she is also a licensed professional counselor trained in CMDR. And then I have Julie Nelson, who's a firefighter-paramedic in South Metro, which is in the Denver, Colorado area. And she's also a licensed professional counselor candidate focusing on neuroscience. Welcome and thank you so much for joining me today.
Thanks for having us, Lisa.
Thank you. Excited
Thank
to be
you.
here.
So last month, as I mentioned, we did discuss mental health as it was May was Mental Health Month. We're concerned that not all departments may have the training and resources available to train our members. What can they do if they notice that someone that they either work with or associated with, a friend or family member, is having mental health issues?
Yeah, so I think that there's a lot of places where we can start with this. First of all, I think a lot of times things start prior to any stressor coming up at all. So we can build relationships in the firehouse, and I think a lot of us do anyways with our crew. And when we're building relationships, we're really kind of putting pennies or money into that piggy bank so that we're building some trust within our crews and within our organizations, so that if something does happen, then it's not really depleting all of that. We've kind of invested in people from the get-go. So I think really investing people from the beginning and creating those strong bonds is important. But also, I think when somebody is struggling or going through something difficult, I think that a lot of times people think, well, I don't know how to fix this, so I'm not going to do anything. And I think it's really important to recognize that you don't have to be the fixer. In our career, oftentimes I think that because we go on emergencies and we're trained to fix the problems on the emergency scenes, we think that that may be similar when it comes to peer support or helping somebody else out. But the reality is that one of the biggest things that anybody can do for another person is just show up. Showing up can be one of the most powerful things that we can do for somebody if they're struggling.
So true.
Yeah.
Yeah. And there's a lot of evidence showing that just having empathy towards somebody really helps to kind of break down some barriers and allow that space where somebody may feel comfortable to talk through things or to be able to take the next steps to get help. So from a very basic level, I think just showing up and being there for someone, you don't have to know all the right things to say. Sometimes it's just sitting with someone or going and having coffee or going for a walk, but that can be a really powerful way to just kind of build connections and be there for somebody.
And just to follow up on that, going outside the fire service for a little bit right now, everything that's going on in the United States right now, whether you're associated with somebody that is being impacted by it or you're just watching what's going on TV, I think you just made a really good point. Just listen to the individuals that may be scared. They may just be scared. I know I was just somewhere locally. It's a large Hispanic community where I was at, and there was no one on the streets. And I went into an establishment, and the lady actually said to me, she goes, "It's so quiet here. Everyone's afraid to come outside."
Mm.
And it's like, and I'm like, "I'm so sorry." Just listen. She goes, and I just listened to her. I said, "You know what? I'm so sorry. I'm so sorry that's happening to your community." And it just, she's like, thank you. She just wanted, I think, someone to listen to her, that how the people, they're scared. They're scared to come out. I mean, and it's so sad right now. And I think that what you just said, to show empathy and just to listen, is so powerful. And I think right now, I think as a nation, I think a lot of people need to hear what you just said. Um, so thank you for sharing that. Julie, did you have anything to add about that?
I agree 100% with everything Taylor said, and I think that at the end of the day, we're social creatures. We're made to be interconnected with other people, and feeling like we have value is super important. I think something else that's critical is that when people are struggling, often we're really bad at being able to actually resource for ourselves. Like when people are really on the struggle bus, sometimes the most powerful thing is saying, you know what, I don't know exactly what I could do to help you, but would you be okay if I tried to help you get some assistance? And then it's like if you have resources at your department through EAP or peer support, you can certainly go that route. Some other options, I did some extensive phone calling this morning, and you can contact the International Association of Firefighters Center for Excellence 24 hours a day, 7 days a week at 855-900-8437. You can also look up their website, and they have multiple resources on there. They're doing a couple webinars twice a month. They've got some psychoeducation stuff. They have a inpatient 35 to 45-day inpatient program that's located in Maryland. And then they're also working on building one on the West Coast that's not complete yet, but that will be coming. Some other resources, if it's okay, I'll just go down them briefly. We have a whole bunch of Warrior Path programs. So one of them is called Permission to Start Dreaming Foundation, Gig Harbor, Washington. Boulder Crest is one of kind of the original mental health resources. They have a program in Arizona and Virginia. There's Eagle Oak Retreat in Texas, Sheepdog Impact in Arizona, Red Barn Retreat in South Carolina, Camp South Ground in Georgia, Gratitude America in Florida. And then more specifically for TBI and PTSD patients, there's outpatient and inpatient programs located at the Marcus Institute for Brain Health in Aurora, Colorado, the Medical College of Wisconsin, the Moss Rehab in Philadelphia, Pennsylvania, University of North Carolina in Chapel Hill. There's the Share Military Initiative at Shepherd Center, Atlanta, Georgia, the University of Florida Brain Wellness Program, and then there's also FHE Health in Florida, which is the Shatterproof program, which is an amazing program. Here in Colorado, we have resources are available for independently seeking services and getting reimbursement through the Path for EMS and the Firefighter Trust. There's also, it's a calling foundation, which provides reduced cost counseling for first responders. So I know that was kind of a big diatribe, but I know sometimes people are struggling with resources. When I spoke to the IFF care coordinator, she said, absolutely, people can call us for themselves or another person, and we can help get them resourced locally. They have a lot of contacts. So I think that that's a great option for somebody that maybe they're at a volunteer department and their friend is struggling and they're not really sure what to do. That's a good resource. Taylor, do you have any ones? I know when we talked earlier, I think you had some maybe other ones that I didn't mention.
Yeah, so I think, throughout the country, where departments are with their peer support programs and the different resources they have available from them is vastly different. So some departments have a ton of resources. They have their own clinicians. They have access to all sorts of different type of therapies, where other departments across the country may not have access to anything other than maybe their EAP. And so one thing that I think is helpful to know, or if there's somebody that's passionate about helping their department find these resources, is when somebody is in crisis or they're really struggling, they feel kind of like Julie said, very under-resourced. They have a very difficult time finding the motivation or being able to figure out, like, where do I go to get help with this? And so one of the biggest things that we can do for people when they're really struggling is try to have that set up prior so that if somebody is struggling, they do have the ability to know where they should be able to go. Because sometimes making that first phone call or going into a clinician for the first time can be really scary and really overwhelming. And so just reducing that. So Julie gave an excellent list of resources. And these are different in every state. One thing that's kind of difficult, right, is that as therapists, we're only licensed in our state. So we can't see other clients from other states. So every state has kind of different resources, different therapists that they can plug into. And so as a department, just kind of researching what's available in your district, I think is really helpful. So that really is a big benefit to your members if they have somewhere that they can go and find some of the resources that they can plug into. So I think, Julie, you had a really great list. Foundation 1023 also offers reduced cost therapy in Texas and Colorado. So that's another one. But I also think it might be helpful, Julie, I know you talked about, like, what are some of the different types of therapies that people may plug into that can benefit them as well.
Oh, 100%. Yeah, I think you should start out. You're an EMDR therapist, so that's a great place to start if you're.
Yeah, so there's a ton of different types of therapies, right? So there's talk therapy, cognitive behavioral therapy. I am trained in something called EMDR therapy, which is eye movement desensitization and reprocessing therapy. It's a huge name, but it has a ton of research that's backed. It's been very researched to help with trauma. And essentially what it does is it uses bilateral stimulation. So this is this left to right movement. So whether you're holding these pulsars in your hands or your eyes are moving back and forth, it uses bilateral stimulation to left or right movement to help your brain process through different traumas. So in our careers, when we go on different calls, sometimes a difficult call might get stuck in our brain and it might have a pretty high emotional response as we're thinking about it. And so what EMDR therapy does is it helps to kind of unstick that. And it's really successful. It can be used for a lot of different things. Trauma is one of the biggest ones, or as some type of a disturbing event, but you can also use it for substance use and other things. But the reason why I really love EMDR is because when clients come in, their brain is doing the work and they are thinking about whatever the incident is that they are trying to process, and they don't have to talk about all of the details. So sometimes one of the things that keeps people out of the counseling office is they feel like they're going to have to talk about everything, and it's going to be really hard to talk about those things. And EMDR therapy, you don't have to verbalize all of that stuff. Your brain just kind of talks through it, thinks through it, and then the therapist helps to guide that process. The sooner that happens, the sooner that you go in and get EMDR therapy, the easier it is for your brain to process things. I think about it like wet cement. So after a call, in those first 30 days, that is kind of wet cement. It can be molded into different ways, but the longer that it sits there where we don't process through things, then the harder it is to kind of to mold that. So not to say that you can't, but it just sometimes takes longer if it's something that happened 10 years ago versus 30 to 60 days ago. So I've had people come in the office after a difficult incident that said they were on a 9 out of a scale of 1 to 10, and after a session of EMDR were maybe at a 2. So it's really amazing. And really what it does is it takes that emotional feeling away from the call. So you're not ever going to forget that call, but it may not have the emotional response that it once did. So really cool type of therapy.
Love it.
Yeah. So we just talked about resources and Julie's therapy, but so do you think, and it may happen in your departments, but do you think that recruit firefighters should receive training in the fire academy on how to handle mental health issues and why it's important and not to let the issues linger? I mean, we teach them everything else. We teach them ladders, hose, ventilation, building construction, EMS, hazardous materials, confined space. I mean, I can go on and on what we teach them, but sometimes it's like the things that we're not teaching is what we should be teaching. So, do you feel that it would be beneficial to bring up the topic of mental health in a recruit academy when before they've really the majority of them probably have not worked in a fire department before, to expose them to what they may see and then how to deal with it?
1000%. In my opinion, this job, we're going to kind of ask you to walk through the cesspool of humanity, right? So it's like they give you knee-high boots in the job, and I think we should start thinking of it a little bit more proactively. Not that everybody's going to be traumatized by it. I don't think that's the right message at all, but
Yeah.
just like a surgeon is trained to wash their hands a certain way, I think it's like you're going to walk through the cesspool of humanity. We're going to provide you showers and you need to get yourself scrubbed off. And a lot of that is creating healthy habits around good sleep, around fitness, around nutrition, around kind of your headspace and how you think about things like the stories that we tell ourselves about our experiences really that's what we build our memories off of. So, like, I think over the years as a firefighter, I've become much better at being more objective and not blaming myself for, just a lot of what we see as these super hard situations that we can't do anything about. And I think early on in my career, I really took a lot of that on. But sometimes that's kind of the power of peer support or other people on your crew that are able to impact how you're individually visualizing those things. Does that make sense? Or do you guys agree with that?
No, I agree with it. I mean, we teach them everything else that they're going to be exposed to in the fire service, and I think that if we introduce them to the topic of mental health and peer support, because we hear peer support a lot, and I still think there's people in the fire service that really don't comprehend what peer support is. I mean, can one of you like explain what peer support actually is? I mean, we all are familiar, like I do a lot of assessment centers and they always throw out EAP, EAP, EAP. And then you wonder if they even know what they're talking about when they're saying EAP sometimes because it doesn't really relate to the situation. It's just something like a catchphrase that they should use if they have a personnel issue. I mean, refer them to EAP. I'm going to refer them to the
Yeah.
chaplain. But you sit there and you wonder, do they even really know what EAP is? What is peer support? What is, what if they do have a chaplain on their department? What do they actually help them with?
Yeah, so peer support is great. So it kind of is what it sounds like. It's peers supporting peers. Um, but there is some difference between somebody who's trained in peer support and goes through a class learning about the basics of mental health and being there for someone, and somebody who's just kind of a friend or a supporter on the job. So what's different about peer support is that it's a group of people that have some training. Usually it's a 40-hour class. It varies though, based on where you get this training to be able to support the peers. How it differs and why it's really cool is because if you are talking to somebody about under a peer support and it's a peer support conversation, that conversation is legally confidential. So that means that you can't be subpoenaed into court to talk about what somebody told you in peer support. It also means that somebody who's on the peer support team can't talk about what they talked about to somebody else, because we all know the telephone, tell a friend, tell a firefighter, right? So
Yeah.
sometimes people are really worried about talking about what's going on in their lives and getting support because they're worried it's going to go through the entire department. Whereas peer support, it can't do that. The success of a peer support program is based on the confidentiality of that program. So I know, like in our program, we assign peer support member to each person in the that's going through the academy so that they have somebody that they feel like they can talk to. And like Julie said, mental health is an ongoing thing from the beginning of the academy, all the way through our career. We should be getting additional resources and trainings and awareness. firefighters are really smart people. You give them the tools, they're gonna implement them, right? They're gonna know what to do with them. So the more tools we can give them, the better. Sometimes right in the academy, people are a little bit overwhelmed. So some stuff may not stick because they're just overwhelmed with information. But that doesn't mean that we can't start there and then continue to build on that over time.
You just made a good point, Taylor. So, we do inundate them with numerous training in the recruit academy. So I know sexual harassment. All departments go through sexual harassment training every year and have first responder fro and such like things like that. But so do you think that having training every month or not every month, excuse me, every year on mental health would be beneficial?
I personally do. I think it's something that if we're trying to reduce the stigma in the fire service and we're trying to provide more education, yeah, every year having some type of training on mental health is absolutely beneficial and important. And the more that people build a peer support program and the department feels like it's beneficial and people get benefit from it, or they see counseling and people talk about it, the more willing other people are going to go do the same thing, because we like to hear about people's successes, and people sharing their vulnerabilities actually is really great in helping other people realize that it's okay if they're going through difficult things, because let's be honest, like all of us are going to go through difficult things in this career. So having some of that support is really important.
You hit on
Totally
it.
agree.
Go ahead, Julie. Sorry. Go ahead.
Oh, I just was gonna say, I think if we start putting it in people's minds at the beginning of their career, like if we spent 2 or 3% of the time that we spend on our physical health and staying in shape on kind of our mental health and just learning. I think when you understand the physiology behind like how memory works and the purpose of it and the nervous system and over arousal, and you learn how to downregulate your body and you learn how to manipulate your memories, I think it's really empowering, and I think it takes a lot of the shame away for people. um I know we're going to talk about stigma a little bit down the road, so I won't bring it up so much now, but I just think that knowledge is power, and I think especially kind of on the EMS paramedic side, we really like to understand how our bodies and our brains work. And if you understand that, then it's like, oh, well, this is what's happening. And then it gives you the power to sort of work with your own system, or to, advocate for yourself, and again, kind of choose healthy habits or coping. And in my view, I think it's interesting on the peer support level, we've seen a big upsurgence in teams across the country, and I think it's great. But I think there's also a lot of people who go through the program, and then once they're completed with it, it's sort of like, well, I'm ready to go out, I'm ready to help, and I'm ready to, like be this mini counselor. And I think, in my opinion, a lot of it is really about doing your own work and trying things and sharing those experiences with other people, and then knowing what the resources are and helping people get resources when they need them, versus like, I'm going to be going out and doing a formal debriefing, or like thinking that 50 people are going to be calling you all the time for crisis intervention, because I think that that's just much less common. A lot more of it is just in casual conversation, or just, which I think has been a huge shift over my career in the fire service, that people actually are talking about these things a little bit more than they used to, which is great.
I agree with you. Um, so we just kind of briefly talked about it, but mental health in the past has had a stigma associated with it, especially in the fire service. That, and we can go into the sports world, you're not supposed to cry. Do you feel that it's changing the more that mental health is brought to the forefront? Do you see like more people being willing to come and say, I have a problem, I don't feel all right, I need, or, I mean, because I know when I worked, no one ever came and said, this call affected me. No, I'm not, I'm just going to tough it. I mean, I had officers say, just toughen it out. So,
Yeah, absolutely. I think it's getting better, but we still have some work to do. I think a lot of it is shifting. in the fire service and emergency services in general, the more education that we have, just kind of like what Julie was talking about. And the more credibility that we build in our peer support teams and with the resources we have, the more people feel comfortable using those, talking about them, and kind of being vulnerable. So I do think that it is shifting. And education is powerful too, right? Because a lot of times what happens is people go on a difficult call or they have something happen in their lives and they're like, okay, I'm just gonna put it over here. I'm gonna pretend it doesn't exist. And if I pretend it doesn't exist and I make myself super busy, then it's just gonna go away and it's not there. And what I like to explain to people a lot of times is stress, trauma, the things that we have going on in our life is energy. And if you go back to physics, energy cannot be created or destroyed. It can only be converted and formed. And so if we think about stress and trauma in that way, if we put it aside and do nothing with it, it is going to come up in other places in our lives. It will, I promise. It's going to come up as irritability, difficulty sleeping, rumination at night, apathy, and just not feeling like you're engaged, or it's going to come out with isolation or trying to numb it with substances. And so I think understanding like how our brain works and that it actually does need to process through those traumas to be able to file correctly is really, really helpful. And people can grasp onto those concepts on like what is going on in our brain, or what are some tools I can have that are going to help me if I go on a difficult call? What is some education that we can give people? Because you'll see people after difficult calls saying like, man, I keep thinking about this and I don't know what's wrong with me. Well, there's nothing wrong with you. There's nothing, we're human. We have empathy. It's okay if something bothered you. And it's also okay if it's something didn't. So all of us are different with different experiences. And I think just normalizing like what people are going through is really important.
Totally agree. I think it's interesting if you look really into the history of psychology, like the first really big mental asylum was in England back in the day. And when you got put in there, you didn't get to come back out. And it wasn't about treatment, it was about getting you out of society. It was about sort of caging you away and forgetting about you. And there were a lot of just I mean, people were really treated poorly in those institutions. A lot of them starved and just I won't get into it, but I mean, it wasn't an experience that was about healing people. It was just about saying that people were no longer of use in society. And so that's how it really starts, right? And then it's like, and then you get into like the frontal lobotomy, which was there's potential for good psychosurgery that can help people that's much more targeted now. But back then it was, somewhat of a barbaric procedure and it got so overutilized just to basically sort of create zombified people that understandably who would want to admit that they struggled with mental health. And then, we have had all these different terms over the years for PTSD, starting with shell shock from World War One. Like if you look at the trenches and the guys were getting blown up so much in the trenches that they were having horrible TBI symptoms, plus the PTSD of the exposure of all the trauma that they were experiencing. And then when All Quiet on the Western Front came out, that was the first book that Hitler or one of the first books that he banned because it really talked about the psychological impact of how hard the war was and just the emotion of it. And so there's a long history and legacy of sort of denying that these things are real and that they're hard. And if you look really at when the white paper was written in the 1960s saying, hey, we have a problem in EMS, we have kind of this totally disorganized disaster of people having ambulance companies and fire departments all over the place, and there's no standards for education, for training, for equipment, and we need to improve this. And so what the first medics in the country were drawn from Vietnam, right? So Vietnam's this 20-year war that we didn't call a war. And then the guys that came back, we treated them terribly in society. Like there's probably not been a war that we treated veterans worse from when they came home. And then these were the people that taught us, right? And so I think it's interesting. Like compartmentalization is a critical aspect of our job. If we feel things so deeply and connect with people so strongly, it's incapacitating. You know, you have to be able to disengage to some degree in order to do the job and to function and be professional. I think that that's critical. Empathy can be debilitating. I think one of the other things though is if we all kind of get a backpack when we're born, and it's like every time we go on some of these traumas, it's like a little grain of sand or a big rock. And if we never stop and kind of empty that backpack out, it can become very, very heavy. So I think just a realization that like you're going to get exposed to a lot of trauma in this job, and there's a lot of different options. Like what might work for me might not work so well for somebody else, but there's loads of things out there. And with podcasts, people can self-educate on different types of therapy, on the nervous system, on understanding the brain and memory, and improve their sleep. Um, I think it's an exciting time because now we know that post-traumatic stress syndrome is not a lifetime diagnosis. It's highly treatable, and there's a lot of really competent practitioners out there that are capable of helping people.
And we
100%. Go ahead, Lisa.
go ahead, go ahead, go
Oh,
ahead.
I was just gonna say, I 100% agree with that. And the more that people at your department have success, then the better that's gonna be with reducing some of that stigma. And just with the IAFF is a lot of resources. So if it's somebody's interested in learning more on mental health and having resources, they have a lot of resources and trainings, and a lot of them are free. So that's a good place to go to.
I was just going to add, Tyler, you mentioned about, excuse me, sleep deprivation and stuff. And so we talk about when we notice somebody's mood changing, or how do we know someone's going through something? I mean,
Mhm.
what are the symptoms we should look for? I mean, as
Yeah.
a
So
medic, not
anytime
even just
somebody
like in the fire service, like for your friends or your
Sure.
family or something. If you notice somebody's acting different, I mean, what are the symptoms kind of, I guess?
I think anytime somebody is off their baseline, and that's where I was saying it's important to kind of check in before and make sure you're building those connections from the get-go. But anytime somebody's off their baseline, are they withdrawing more? Are they more irritable than normal? If you go out to have a beer with someone and they usually have one, and then all of a sudden they have 10, then that might be a little bit of okay, is something going on? Or maybe somebody used to chew tobacco and they quit, and now all of a sudden you notice they've put a chew in. Most people don't start a habit again after quitting something without something like kind of precipitating and a stressor that makes them feel like they want to go to that to get a little bit of relief. And so just kind of cueing into some of those things. I had a great officer one time who taught me a lot, and he said to me, he said, when I come in the morning, I look at you and I say, how are you, Taylor? And I look at Nader and I say, how's Nader? And I look at Carlos and I say, Carlos, how are you? And I do that with intention, because a lot of times I can just tell from your body language how you're doing that day. Are you excited when you say hi? Are you telling me about what you did? Um, are you quieter? So just checking in with your people on an everyday basis too. I think that also taught me a lot on like just kind of cueing into different signs. And then just check in with people, right? Like, hey, I noticed you haven't been around much lately. I really miss seeing you. Is everything going okay? So don't be afraid to ask the questions and check in on people.
I think another huge one is insomnia, like or really poor sleep. And a lot of times I think, this is a job that sleep deprivation is just part of it. But if people, you have a whole night at the station where you don't get up and then somebody's like, I'm not sleeping or whatever, that's one of the biggest indicators or like flashing warning signs pre-suicide is that somebody's dealing with severe insomnia. and they are really dysregulated. So I think that that should be more of like a flashing light sign if somebody's complaining of severe sleep problems that they need to get in. I think one of the best things people can individually do to help, it's tricky. We're in this job around a bunch of other people. We're all pretty mentally tough. We don't like to complain about it, but our reflection, like the people around us, it's like, yeah, I don't sleep that well. I drink a little too much. I'm a little salty, I talk trash about my patients, whatever. That's all pretty normal. So like that doesn't necessarily indicate that anything is off. Like, but it's kind of, I think sometimes it can be like we're all being boiled in the pot together. And so you're just like, hey, are you hot? Yeah, I'm hot too, and that can throw you off a little bit, but I think that that's one area where people's partners can be a really good indicator, or like they're oftentimes much more, I think, objective than we can be. Um, it's interesting from a neuroscience perspective, the right and left hemisphere, like women have a 30% thicker connection in their corpus callosum, which is the thing that brings the two hemispheres together. So we have like more innervation of the left and the right brain, which on the upside, that gives us kind of a greater capacity to sort of see the whole picture, to tap into other people's feelings, to see things on a larger level. The difficult part with that is that we can have more of a difficult time disengaging from that, whereas men are more able to drop into like the left hemisphere and kind of stay over there where they're like, I'm task oriented, I'm doing this project, I'm not thinking or taking that in. And so, I mean, I think that that's a important part of a balanced team, but I've talked to some guys that I'm thinking like, man, are you clueless? Like, how are you not seeing this? And they really need sometimes like hard objective data. And that's where I think like a Whoop strap or an Aura ring, where it's physiological data that they can look at and then go, wow, my sleep is really good or my sleep is not so good. And just creating those things can help you make goals for yourself. So it's like, wow, I'm only sleeping 4 hours of night on days when I'm not at work. That's pretty bad. Maybe I can make a goal to try to get to 5 hours, and then individually research sleep and things that you can do to improve sleep. There's so much data out there that if anybody's actually curious and wants to like try to improve, all they really have to do is, start Googling. You can teach yourself about everything on YouTube.
Yeah. So you could agree or disagree, but I think one of the biggest barriers to for people to seek mental health is to break the stigma that's associated with it. And I think that you both have kind of mentioned that, especially in the fire service, if they see someone else do it, they might be more likely to seek the help they need. But Taylor, you mentioned the IFAC has so many resources available. And I mean, just if no, if anyone gets anything out of this show is to Google IFAC and all the resources that are available, and there's really no stigma associated with mental health. I mean, I think the professional sports teams have really shown that. There've been numerous professional sports athletes that have come out and spoken about mental health and the issues they were dealing with mental health. So hopefully that helps people understand that there should not be a stigma attached with it, that we need to create an environment that where people feel comfortable seeking help without feeling fear or judgment. And I think in the fire service, that's part of the, you want to just go, we've all said it, you just want to go along with the flow. You don't want to stand out, especially if you're new. Um, so do you feel that the media, whether it's social media or mainstream media, has a negative impact on mental health?
Oh, just
I know
because
this is kind of like a loaded question. This is a total loaded
yeah.
question. I'm sorry.
Oh no, it's good. So wow, social media can be great and it can be harmful, right? So it all depends on how we use it. So the reasons why it's great is because, like we've been talking about on this podcast, man, you can learn about anything. You want to make sure that it's factual. what you're learning and makes sense. I think that's with any media source. So you want to make sure that you're learning from reputable sources. But you can go get education on things that you want to learn about from anywhere. So that's a great benefit. It's also helpful in, connecting with resources and doing research for departments or so there's a lot of ways that it's beneficial. As long as we have some boundaries around it, right? So social media can also and media can also create stress as well. So if we're really if we're on social media a lot and we're using that as a release to continuously scroll and look at people's feeds and see, oh, their life looks perfect and it doesn't look as great as mine, or we're using that as our source of connection instead of actually connecting with people, then it can make us feel more lonely, or it can increase, studies have shown that social media, like excessive use, can increase anxiety and depression and suicidality. So we want to make sure that we have some boundaries around how we're using social media and the media. But yeah, I think it can be both. What do you think, Julie?
100%. I mean, you can't argue that. I've looked at the use of it in our careers with, fire departments saying, hey, there's this huge fire. This is an evacuation area. This is where the food's at. This is where, people, it's really beneficial from an emergency services perspective of letting people know there are things coming, things like that. And there can be really positive connection with staying in touch with people that maybe you don't see every day or all the time. But it's interesting from a biological perspective. We have a human natural bias toward negativity. And this is really important for survival that like we would all starve if we never worried about winter or like what's going to happen tomorrow. We would never save money. We wouldn't plan for the future. So it's important that we think about that we mentally catastrophize a little bit about what can happen because that helps us prepare. And that's a big part of our job. But one of the tricky parts with the algorithms and how phones work is that anything that you look at, it sends you more of, right? So if you're like, I'm really worried that an asteroid's going to hit Earth, and you start Googling it, and then you're looking at this, and then all of a sudden you're just getting all this data on like space trash hitting the Earth and all this stuff, and you can become consumed, right? I mean, I see you laughing, Lisa. I'm kind of picking something that's sort of silly, but it is a
No, it's
potential
totally
real
true.
threat, right?
It's totally true.
And so I think that that's where, I can definitely go down, they call it doom scrolling for a reason, right? And especially for our kids, it's like our kids can get hooked on something where it's like, oh my gosh, now they're looping on this thing. And that's where I think it's important to try to have things like mealtime where you're disconnecting from your phone and you're connecting with human beings, going outside and there's this idea called, or it's not an idea, it's a real thing, but grounding, where like you go outside and you put your feet in the dirt. And I remember like, I'm a bit of a hippy dippy. I love being in nature and being outside and camping and all that stuff. But I remember thinking like, this sounds great. I dig it, but this sounds like totally cheesy. But when you really actually look at some of the science, it's pretty valid that like we're electrical creatures, like our heart and our brain, you can like the definition of being brain dead or in asystole is like you don't have any more electrical juice running around in there. The tricky thing is when we walk around with shoes on all the time, we basically, I mean, no different than building up static electricity. You build up this charge inside your body, and the way that you discharge that is by touching the dirt, by touching the earth. And I think that I've done it where I try to do it routinely, where in the morning I just walk around in the grass barefoot, and it's amazing. Just psychologically, it feels nice. There's an interesting um it's on YouTube. It's called Earthing, and it's all about kind of this. He's really a scientist guy, but he goes into all the data, and there's quite a bit of peer-reviewed data. But just these things like going outside, getting sunlight on your face in the morning, like we are biological creatures that are designed to live in nature and to be in touch with the earth, and to live inside all the time with shoes on and artificial light. Like it's not it's not really health food for our brain, body, or soul, you know? So anyway, that's
I think it's awesome. I actually, what's funny about that is that my crew, we've gone out and done grounding in the morning.
Okay.
And
do they like it?
oh yeah, I mean we're all standing in the grass kind of, we'll bring our coffee out there. We had a LCSO officer drive by one time and they're like, what are you guys doing? But it's nice to disconnect from all of that media. And you kind of touched on this, but mindfulness is really important. And so when we're talking about social media or anything in our life, I think a question to ask is, does this fuel you? Does this make you better, or does this drain you? And so if you're learning about something that's fueling you, if we're using it to be better at our jobs, right? But figuring out what that distinction is versus are we just trying to fill space in our brain when we could be using it for other purposes, right? And it kind of goes back to what I was talking about, how firefighters are really good at like stuffing something aside and keeping ourselves really busy so we don't have to think about it. And scrolling social media or anything else can be just like that. You're distracting yourself so you don't have to think about what's really going on. Where mindfulness practices, whether it's grounding or whether it's yoga or whether it's a meditation or whether it's just going for a walk without being on your phone or attached to different devices, is really, really good for us. We are in a fast-paced job, and so it is really good for us to slow down and give our brain time and space to process the things that are going on in our life, to be able to process those traumas, to be able to process those stressors. And if we do different things like mindfulness or grounding, that gives our brain some space to do that. Because if we don't do it, a lot of times what we'll see is kind of talking back about sleep, right? Is that people try to go to sleep and now their brain is like ruminating on something or thinking about stuff because it's saying, well, you've kept me busy all day long and now you're trying to rest. So this might be a good time to think about all those things you didn't let me think about before. And so adding some mindfulness in can help with that and really, really benefit with our processing of things, but also just that hypervigilant response that we're like a lot of times we're in that fight or flight response just based on our job for long periods of time. And so just kind of equalizing that.
Well, and there's some cool new technologies out there now. There's Sensate makes a vagus nerve stimulator that it's sort of a large almond-shaped disc that goes on the outside of your kind of sternum. You hang it around your neck, and then you put like earphones on, and it basically creates this vibrating, pulsating disc on your chest, and then it's hooked into this musical like nature soundtrack type things. And so I think for a lot of us, myself included, it's like I'll say, I'm going to go meditate. And then I sit for about 15 or 20 seconds and I'm like, well, I've got my whole to-do list planned for the day. And I'm like, well, I took 3 deep breaths. That's good enough, right? Like I think we all stink at idling in this job. And so sometimes tools like that or Mindspace has some stuff. The what's the big one people use for sleep? Oh my gosh, I'm trying to Calm. The Calm app has a lot of kind of guided meditations and things like that. And I think sometimes having a tool can be a lot more helpful for, I would call myself a beginning meditator. Like just if I'm left to my own devices, I really struggle to sort of sit still with my eyes closed for 5 minutes, I'm not good at that. So the vagus nerve stimulator, I'd highly recommend. Pulsetto also makes one. Pulsetto is a device that you strap around your neck and it actually sits kind of right on the important vessels in your neck. And then it sends electrical stim gently through your neck. So it's interesting. Like that one, I would say doesn't feel as relaxing and the tracks aren't as cool as the Sensate one. But I've had a good release with my TMJ. Like if I use it before bed, I don't tend to grind my teeth at night. And like at work, I've brought it to the station and had a bunch of people try it. And some people that go to work and like never go number two at work, we're like, I have to go to the bathroom right now, so it's pretty interesting physiological data, definite drops in blood pressure, things like that. And looking at it from an electrophysiological level, we get stuck in fifth, sixth gear in this job. Like this hyperarousal creates all this excitement in your brain. And so if you think about it, like if you tried to go to bed and your heart rate was at 150 or 160, you just wouldn't be able to fall asleep, right? You'd be like, my heart is racing. And kind of the same thing is happening in your brain when you look at the electricity up there. It's like over time, a lot of people develop a lack of alpha and theta, which are like second and third gear in the brain. And you need those gears to be able to transition down from high functioning and thinking to deep sleep. So, like, I'm learning neurofeedback right now, and I've had great success with it. It's really cool. It's basically you're looking at all the electricity in the brain, and then you're training different parts of the brain to kind of upregulate or downregulate depending on what is happening. But like when people talk about survival brain hijacking, it's basically over arousal of your primal brain. Like a lot of us think, I have ADHD or I can't concentrate, or how come we go to a meeting with, 30 of us and we're all like a bunch of 5-year-olds in there. And it's because we have this survival brain hijacking from being chronically overstimulated. Like the mammalian brain and the our dinosaur brain, basically, those are fully developed before we're born. Totally done. And the frontal lobe, 25 years. It's the oldest, it's the last system to develop in the brain, your frontal lobe. And that's really where the brakes are. That's where our impulse control is. But when we're under stressed, that old brain totally takes over, which it's awesome, right? Like I don't want to tell my pancreas what to do or all these other things that are constantly being regulated by the nervous system. But if we don't understand how to kind of manipulate that system, it can mess us up. So like if you Google physiological sigh by Huberman, there's a 2 or 3 minute video that he does that's basically like you take an inhale in and then you air stack another one on top and then you exhale slowly. So you go, or you should do it with your mouth closed. This automatically slows everything down. So, like a lot of times we try to control our brain with our brain, but what we really want to do is control our brain with our body. So, we send a sense of safety to our brain if we utilize techniques like breath work or we go out and exercise. Like when we're over aroused, our brain is telling our body, you need to move, you need to do something, like there's danger, there's a threat. So going out and doing things to exercise are it's really, really beneficial. Things like yoga have now been validated as like effective long-term strategies basically for management of PTSD that's resistant to treatment. And basically it's a combination of physical exercise and breath work where you are turning the volume down on the whole system. Taylor,
Yeah.
some of your stuff with mindset reps that's part of it, right? Is movement.
Yeah, so actually, kind of what got me into the therapy world in the first place was actually working out with a bunch of teenagers through a nonprofit that I had and recognizing that they were more willing to open up after exercise. And so when I went back to school, I specifically started studying integrating mental and physical fitness and health together because everything is connected, right? It's hard to just look at one thing. And when really everything's connected, whether it's our physical health, our sleep, the stressors that we have going on in our life, relationships, like everything kind of plays off of each other. But when I started going back to school and learning about mental health and physical health, what I noticed is that all of the things that first responders struggle with, all of them, whether that's sleep or cardiac health being a big risk factor for firefighters, or stress, or trauma. Almost all of those things, hyperarousal, can be combated with exercise. Exercise is one of the best things that we can do for our mental health. So studies have shown that exercise can be just as effective as some depression and anxiety medications. So it's really powerful when it comes to that. It's also really amazing when you were talking about trauma as well. So actually, Francine Shapiro, who developed EMDR, it got developed because she was walking, so that bilateral stimulation. And she realized that when she was thinking about something distressing, her eyes were moving back and forth, and that it would become less intense if she was doing something like walking or doing something that kind of had that bilateral stimulation. So if you think about it, like walking or running is a really good way to process things. And I don't know if anybody else has had this experience, but sometimes I think of my best ideas or I process through some of the most difficult things that are going on in my life when I go for a hike or a run. It's like my brain, it just allows my brain to like think about these things that I wasn't thinking about before. So it's a really amazing therapy. And it's definitely something that firefighters can get on board with, right? When you say, hey, we should work out, they're like, awesome. So yeah, it's like people want to do that. And actually in Colorado, if anyone's in Colorado, we have monthly first responder workouts. It's just like a way to build community and work out together. And so that's on our website at mindsetreps.com. You can find that information, but exercise is huge. Same thing with yoga, mindfulness, all of that kind of stuff that we talked about and why that's important. Connecting to that body, because the stress, trauma that's like kept in it is kept in our body. They go together.
Julie, did you have anything to add?
Well, just when it's interesting, we don't 100% understand the full physiology yet behind why EMDR works, but we do know that it works. But when you look at the EEG in the brain, like basically all this information's coming in through our eyes during the day, and then it goes to the back of the head at O1 and O2, and then the T6, which is kind of if you like trace your fingers just a little bit behind your right ear, that is actually the area where you store emotional trauma in your brain. And that part of your brain, it's deep in there and it's a non-verbal part of your brain. So like EMDR, you're revisiting and you're like every time we revisit a memory, there's malleability to it. And Taylor, I'd never heard that analogy before with the concrete, but I really like that analogy of like at the beginning, you have a greater capacity to sort of like just like a wound. If you cleaned a wound out right away, it'd probably heal up pretty good versus like, let's just cover that up and pretend it's not there. And then you're dealing with an abscess and long-term problems. But I think the part of the power of EMDR, because it's not talking based, where talk is your left frontal lobe, that's up in Broca's area. It's a completely different spot, and you have impact with talk therapy for sure, but really sinking into the emotions and the experience without having to verbalize it can be really powerful. And I think especially for anybody who has like a shame-based memory one way or another, whether that's really old or whatever it is, sometimes it can be really liberating to just sit with someone in that space, but not to have to tell them all the details.
Mhm.
And I think a lot of times when you ask someone what's going on, they'll say, I don't want to talk about it. So
Sure.
this is like a therapy that could be used to help somebody realize that they don't have to talk about it, but there's help available for them not to have to talk. So we are just about out of time. Does anyone have anything they'd like to add? Taylor, can you give your website one more time that you have?
Yeah, it's mindsetreps.com. And we do have some resources on there. We're actually just launching a new resiliency program for first responders, which is going to be really cool. It's called Shift. The wait list is mindsetreps360.com for that. But it's going to be a really comprehensive class on all things first responders face and all those dimensions in wellness. And it also has like a fitness program, of course, to go along with that as well. So, and of course, as always, if anybody has any questions, I am always available. If anybody wants to email me which is taylor@mindsetreps.com. I'm happy to help with any resources or guide anybody in the right direction or answer any questions as well.
Julie, you want to give out your email or?
Sure. It's julie.nelson@southmetro.org. My phone number is 303-709. Oh, no phone number.
No, you
Okay,
can
never
give it
mind.
out. At least you can.
You can just
Go
email
ahead.
me if you have
No,
any
give out your number.
questions.
If you don't have a problem with people calling you, yeah, I'll give out your number.
303-709-4098 is my cell. Just leave a message. I'll call you back. It's an exciting time to be alive. We understand so much more about neuroscience and our bodies than we've ever known before. And I think what I really want to encourage people to do is just to get curious, you know. I think something that I'd like to be involved with changing is a lot of the mental health videos out there that you watch are just they're agonizing. It's brutal to watch people, tell their stories of PTSD. And while it's really important and wonderful that people are sharing those things, I think one of the hard parts is that, I've just gone through a ton of that data for my degree, and it's heavy, it's hard, and it's not fun to look at. But there is so much good stuff out there that if you Google resilience, if you Google like just data is your friend, and understanding what's going on in your brain and your body they're powerful. And so especially for folks that are new in the job, you have the opportunity like to potentially have a much better career than many people. Like suicide losses over my career have been a big motivating factor for me to go into this job. But if you look at suicide as being, that's really like the worst possible case, right? How many people sort of are going through their careers doing like a silent life of desperation where they're really not happy coming to work anymore and they're really struggling. There's a lot of great resources out there, and all you have to do is start looking and ask for help if you need it. Thanks so much.
So,
Thank you.
so ignoring mental health issues can have severe long-term consequences affecting every aspect of a person's life. Today, my two fantastic guests have presented numerous resources that are available for someone that is experiencing mental health crisis or just mental health to talk to. And I'm going to reiterate the IFAC has excellent mental health website. So once again, I want to thank each guest for being a part of the radio show. Thanks for Fire Engineering again for allowing to be part of your monthly podcast. Thanks to all the listeners and members of Women in Fire. Remember to follow us on Facebook and Instagram and LinkedIn, and to check out our website at womeninfire.org.